All right, Christina.
All right.
All right, I'm a go.
We're broadcasting.
All right. As people are led into the room, I'll just wait a moment. Good morning, everybody. I'm just waiting for people to be let out of the lobby. Quick question. All right. Looks like that number stopped ticking for now. I'm sure others will dial in a moment. We'll go ahead and get started. Good morning, everybody. Happy Monday. I hope everyone had a wonderful weekend, safe at home with friends and family, of course. But my name is Maria Thacker-Goethe. I'm President and CEO for Georgia Bio. I also oversee the Georgia Global Health Alliance. I know we welcome today a few people from that community as well. This morning, things are changing in Georgia again, and we're very excited to welcome Congressman Drew Ferguson with us this morning. The past few months has really launched an extraordinary era for us. The impact of the coronavirus and COVID-19 has redefined what it means to be on the front lines of healthcare. We continue to experience an incredibly challenging and surreal year. It's precipitated by an unseen enemy. It's sickened hundreds of thousands of people around the world, pushed our healthcare system to its limits and taken far too many lives. And of course, it's challenged our economy in ways it's never been challenged before. The life sciences industry, biotech, and medical devices alike are at the forefront of this. And Georgia's uniquely positioned through our institute to really develop and train future workforce needs to really respond to this and prepare for anything like this in the future, as well as help us get through the next coming years. So this morning, we're very excited for another one of our town halls to welcome Congressman Drew Ferguson. Congressman Ferguson is a proud resident of West Point, whose family roots are in West Georgia area with several generations deep. He attended the University of Georgia and gained early acceptance to the Medical College of Georgia. After graduating with a degree in dental medicine, he moved back to his hometown and established a successful dental practice. In 2008, Congressman Ferguson was elected mayor of West Point and was at the forefront of attracting and keeping jobs in his community. By lowering taxes, eliminating government barriers, and reforming education, he led a community in economic ruin back to life. Today, a wide range of new businesses and industries call West Point home. Led by Kia Motors, automotive suppliers, and related businesses, 6,000 new jobs have been created so far. Congressman Ferguson came to Washington to apply the lessons he learned revitalizing West Point to create policies that once again make America the most competitive place to do business. So it's a pleasure to have you, Congressman Ferguson. Thank you for joining us.
Well, good morning, Maria, and thanks for the chance to be with you today. And to everyone on the call, I appreciate your time today. Many of you I have spoken to in the past, and some during this crisis, and as always, appreciate the conversations, the good ideas that come from the private sector, and really kind of the collaborative nature of how a lot of these conversations have gone. So thank you for that. Certainly, Maria, as you have indicated, we are in unprecedented times. However, I truly believe that we're closer to the end of this than we are the beginning at this point on several fronts. And I think, and from what I have seen so far, going forward, I think that America is ready to go back to work. I think the big question mark is, how do we do it safely and how do we do it effectively? Just a quick recap of kind of what we've done, what we've been focused on. We knew right off the bat that this was going to be a tremendous economic hardship on a lot of different sectors of the economy. Probably most importantly, the small business sector, because these small businesses just simply do not have the sustainability that larger companies do. and providing liquidity to those businesses to get them through a period where they would have no revenue, and being able to keep their employees attached to them was our primary focus from an economic standpoint. So we have put a lot of effort into the PPP loan program, which has been wildly successful, and saw some interesting data yesterday. The second tranche of money, if you will, appears very much to be going to those smallest and most vulnerable businesses, and that's really good right now. A lot of sole proprietors, self-employed independent contractors now are engaged in this process. And I think that our banking community has done an amazing job of help implementing this program to be able to get close to $600 billion out the door in just a matter of weeks is really a testament to the public-private partnership that that's existed there. We have also in the last CARES package that Congress passed, we put a significant amount of money into testing capability. $25 billion went to that, which we think is important and something that from a healthcare provider standpoint, we think that that's going to be a key to making sure that not only are our patients safe and getting the appropriate care, but also our employees. We want to make sure that the employees that come back to work in the healthcare setting, in something like a dental office or a physician's clinic, want to make sure that they feel comfortable coming in as well. And so there's been a tremendous emphasis there. I know many of you on the line have been engaged in that, and I thank you for your work in not only the testing arena, but also the vaccine arena as well. I'll give you another area that I think is that we're going to have to focus on going forward, and it's something that I think will be important, is going to be the supply chain for businesses to get up and going. And when I talk about the supply chain, I'm not talking about necessarily the manufacturing side of it that's gotten so much attention on bringing that back from China. But I'm talking about the supply chain of how do healthcare providers and hospitals and businesses access PPE equipment, hand sanitizers, the basic things that are going to be needed to reopen the economy. So I think that's going to be an ongoing focus. And on that note, I think that where Congress is next, one of the areas where we're focused on is providing some level of guidance and assurity to both employers, employees, and customers. What do they need to effectively reopen their businesses and get back to business as usual, or get back to business? I don't think we will ever see business as usual as we did 6 months ago. There will be changes across all sectors of the economy, looking at how businesses and customers adapt to this new environment. So I think, again, I think businesses are looking for clear guidance. Maria, I think you said we were going to have some folks from the CDC on the guideline on the phone. I would make this request to be as clear as possible when making CDC recommendations for what is considered safe practices. Employers need that, and customers need that as well. And being able to have some sort of gold standard, if you will, that if an employer does a certain number of things that they're doing what's right by their employees, it will give them some comfort in reopening and bringing employees back. But also making sure that if we could have something that if a business does, this list of items that they would get, for lack of a better term, a good housekeeping stamp of approval, being very clear in that, definitive and quick would be welcome. And we're happy to be engaged in that process. Research and development going forward, I think it's a remarkable change in the conversation from where we were just a few months ago regarding the biopharmaceutical industry, drug makers, research and development here in the U.S. It wasn't that long ago that the focus of the attention were doing some really arcane things in Congress. Basically, as we described it in the committee meeting, it was a socialist takeover of the pharmaceutical and bio industries. And what the proposals that were being pushed, we know would have devastated research and development and production here in the United States of America, not something that we wanted. Well, I think what's been remarkable is that our biotech and pharmaceutical companies here in the U.S. are leading the world's efforts to get vaccines, therapeutics, and the preventive side of this all going together. And I think that our American innovation and our productivity are what are going to lead the world back to a better spot. And I think it has shown the value of being able to do the production and the research here in the U.S. And I want to be mindful of the supply chain issues, but also recognize that the things that we need to do we need to focus on making America the most competitive place in the world for you to do your business. Whether that is through the tax code, through the regulatory code, through the education code, all of the things that are needed there to make America competitive. And quite candidly, an area that we spend a lot of time working on and thinking about is how do we change the environment around dollars going into research and development and creating a more patient capital stream from the private sector that gives people the resources that they need to work on these amazing new drugs and cures, and trying to figure out how do we change the value of capital on the front end so that there's a greater incentive for investment in exchange for perhaps a lower cost on the back end of that capital. Meaning, if you could treat our R&D capital and investors could get the value of that on the front end, maybe there would not be as high demand for a higher price on the back end. Again, we've talked to some members about that and happy to explore that more down the road. But with that, I think America's ready to go back to work. I think they want to do it smartly. I think they want to do it safely. And I'm going to give you one story from over the weekend to kind of highlight what I'm saying and why I think that. I had the honor and privilege of going to Piedmont Hospital in Newnan, Georgia this weekend to watch the Blue Angels and the Thunderbirds fly over and honor our healthcare workers. It was a pretty special moment, and you could tell that the community wanted to do two things. They wanted to honor our frontline healthcare workers, and they wanted to get out and be with their fellow members of a community and celebrate something. And when I tell you, driving up to Piedmont Hospital, there were literally thousands of people lining the roads, lawn chairs out, coolers beside them, cheering, very festive atmosphere. There were probably several more thousand people in the parking lots of Piedmont. People were hungry to get out and to go do something that felt normal to them. And here's another interesting, besides that gathering and that sort of festive atmosphere, afterwards, I went to do something that I had needed to do for many weeks, and that is to get a haircut. So I went to the local place that I get to in Newnan, Georgia, that I'll go sometimes to get my haircut. It was a little sports clips. And there was an hour and a half wait to get in line for another hour and a half wait. Okay. And bottom line, people were there. The line for Chick-fil-A was stretched out probably 1/8 of a mile, and every other business that I saw there that was allowed to be open had a significant amount of activity, and the traffic looked almost like a normal weekend traffic day in Newnan County to County. Every place was busy except one, and that was the drive-through testing center that was in the middle of all of this. And there were two people in the parking lot, and I went over and I spoke to them and thanked them for what they were doing. And I asked them, I said, how many tests have you done today? And the lady said 2. And they said, and I said, okay. I said, how many did you do yesterday? She said, we're averaging about 3 or 4 a day at this point. Okay. Point is, if testing were what every single American wanted and felt like was important, the line through the testing venue would have been it would have been out 1/8 of a mile, not the line at Chick-fil-A. My point is, there were a lot of people that were out, that testing was available to them, and they chose to do other things. I give that to you just as an observation from the weekend, my first real weekend of being out, traveling around, seeing what was going on, being in different parts of the district. And I thought that was something that just stuck with me. So with that, Maria, I'm happy to take questions and happy to get engaged here. And by all means, as I always say, if there is something here that we're off base on, never hesitate to let us know. We only know what we know, and if there are, if there are ideas that you have, or there are things that we may not be as up to date as you are on something, happy to get that feedback. So Maria, happy to take questions.
Thank you, Congressman, and I appreciate that observation. I think I'm not sure if you're aware, we launched a Global Health Crisis Coordination Center been about 6 weeks now, but publicly about 2 weeks ago. It was seeded by Microsoft and CDC Foundation, and one of the things we're really working on is that testing aspect, but also the communications and narrative around the value and importance of testing, so people can get back to work and really embrace that social engagement and see and hug their friends again. So it's really important that we really work to drive home that narrative to make sure we have the good data to support us all going back to work safely, so we don't overwhelm our hospital and our system again. So I appreciate that observation. And I will say that your hair looks great, and I think Chick-fil-A lines are always that long, even in the best situations. So, because goodness knows
they are in Georgia, for sure, yeah.
So we do have some questions that have popped in. So and you did touch on some of these, but I just want to see if you could maybe expand a bit. So first question, is Georgia's government tracking the tracking the RT COVID-19 tracking data to make informed decisions regarding reopening our state?
I think they are, from what I can gather. We have not had a lot of direct communication with the governor's office on this, but we would have to assume that they are looking at data. And I can tell you what I know in the 3rd District of Georgia. We have capacity here. And I think one of the things that we've got to remember, and I think this is something that's gotten lost in all of this, all of the steps that we have taken and the way that we have always addressed this, it hasn't been about stopping the spread of COVID-19. It's been about slowing the spread of COVID-19 for one reason and one reason only, and that is to keep from overwhelming our hospital system. The last thing that we wanted to see is our fellow Americans in the parking lot of a hospital dying because they couldn't get in to the hospital to get the treatment that they needed. And luckily here in Georgia, we've had capacity to be able to deal with that, with the exception of a few hotspots. Those areas, those hotspots, it's tough. I mean, if you look at what's happened in Dougherty County, if you look at what's happening in Upson County, Thomas, Georgia right now, where they have 2 nursing homes in the county with 68 positive tests and 31 positive healthcare workers, that is a tremendous strain on a rural hospital. But across the state, the things that we see is that we have the capacity to handle patients that come in right now and have the capacity to handle an increased number of patients as they come in. So if the goal was to slow the spread and to have capacity in our healthcare system to take care of those patients that contracted it, then I think that we have got to be, if not at that point or past that point, here in the state of Georgia. And I think our healthcare systems have done an amazing job of adapting, and they have sacrificed a tremendous amount. So from that standpoint, I think that those are the things that the governor is looking at the capacity, and knowing that we've got the capacity to take care of the patients that come in. I think that that's the right approach. I haven't seen the data that they're looking at, so I'm speculating as to what the data that they're looking at. But it would certainly seem, based off of what I've seen here in the 3rd District, the district-wide, we have the capacity. I'm not saying we're completely out of the woods, and we don't need to be crazy in what we're doing in terms of just going out and forgetting some of the basic social distancing protocols, the personal hygiene protocols. I think if Georgians will continue to do that, then I think we do have the capacity to take care of those patients.
Great, thank you for that. So what would you say then is a reasonable timeline for an exit strategy? Is it to get the U.S. business back up and running and reemploy staff? Is it vaccine availability, and mitigation plans, everything, a little bit of everything?
Well, from a timeline to say when we're going to be fully up and running, I think that's, again, I think we've got to proceed cautiously down this road. And I don't think it's realistic to put a timeline on it right now, for the simple fact that we don't know everything about this virus. We don't know exactly how it's going to behave in the coming summer months. We don't know exactly what's going to happen in the fall. And I'll just give you one example in from my former profession in terms of timelines of getting back to work. If you're a dentist right now, and you could probably apply this across just about every sector, what's going to make me feel comfortable opening back up? Do I feel like I can care for my patients? Yes, I do. Am I most concerned about my employees? Yes. So what are going to be the guidelines that I know that I'm practicing by, that make sense, that we know are safe and proven environments for our employees? And this event reminds me, and from a professional standpoint, a lot of what we were dealing with back in the late 80s and early 90s with HIV when it came through. If you remember, we were, from a dental standpoint, and a lot of healthcare standpoint, we were talking about practicing in full body protection suits. Well, as we learned more about the virus and we learned more about the transmission and who those vulnerable populations were, we modified and we came up with very safe practices. I think it's a long way of saying we've got to have some semblance of guidelines that are that are good for the patient and good for the employee, to make sure that they can, that people feel comfortable going back in. And again, part of that is getting the federal government to issue those guidelines, either probably through CDC. And that's going to be with all due respect to the agency, it's going to be a challenge given everything else that they've got going on. There's a full plate there for them, and then to figure out what are reasonable guidelines for each individual sector, I think is going to be a challenge, but I think that's something that's got to happen.
Sure. No, and we're hearing the same thing in our sector. We're actually, and though there will be recommendations, I'm sure, that can apply to all sectors, everyone does have their unique needs. So we're working closely with our counterparts around the country, actually, to build out some general guidelines for life sciences companies. In particular, our counterpart in Massachusetts has provided some useful tools there. So we'll be providing a similar forum for our members around guidance for the labs and other testing companies and all that, because it's a little bit different. It can't be, I don't think anyone believes it can be a blanket recommendations to every industry. So we're really trying to pull that together for our industry. And I think that's something associations in a variety of sectors, whether you're in the restaurant sector and other areas and manufacturing, we're all going to have a little bit of nuances to what we need as we bring our workforce back in. So let me see, I have a question from the audience here. Oh, I apologize, I read that wrong. What is your opinion about some of the proposals to support COBRA for people who are currently unemployed?
I have not seen any of those in writing, so I can't comment on it. But let me say this: there's all kind of conversation right now about what would a phase 4 package look like. For those of you that have been in and around DC, you'll appreciate this comment. What we're dealing with right now feels more, in the environment that we're in, feels more of like a last minute omnibus spending bill at the end of a session, as opposed to a COVID relief package, because we're getting everything under the sun thrown at us right now. And there's so many proposals that come out on a daily basis. And I think it's going to be incredibly difficult to move a big phase 4 package through both houses of Congress and get it signed into law with any kind of speed. So I think a lot of the things that people are talking about, whether it's extending the PPP loan program, whether it's dealing with extensions on, in this case, health insurance, unemployment, how do you get businesses back up and going, whatever it may be, the reality is that there is a chance that we will have this, for the most part, in our rearview mirror and be back to work in some shape, form, or Congress able to fully act on some of these things. And my concern is that if we do act on it and we put into place a bunch of rules and regulations that may be quite candidly out of date as soon as the ink dries on the bill, I think we're going to be really challenged on that. We did a great job on the first few phases of with the CARES Act and the work that we did before then. But now we're starting to see a more normal environment where various groups are coming in, making specific asks, and that's getting interlaced with policy ideas and goals that are driven quite candidly as much by politics as they are public good at this point. So that's why I think it's going to be slow go. A lot of people have hopes and dreams hung on quick passage of a phase 4 when we get back. I could tell you I may be back on a Zoom call with you in a few months telling you how wrong I was, but my gut tells me it is going to be a very, very cumbersome process to get the votes cobbled together to make something happen.
No, thank you for your candidness on that, and I certainly can appreciate the dynamics of DC, the complexities, and then adding the pandemic on top of that is only more challenging. So we do appreciate everything you and your colleagues are doing up there and navigating. And I do imagine these types of conversations we're having with yourself and others, it's changes weekly depending on what's happening, I'm sure. Yeah. Not only with the spread of COVID, but also just the dynamics of DC. So a few other questions here. So you had mentioned public-private partnerships earlier, and I think you'd specified one, but what unique public-private government partnerships have you seen formed to combat the coronavirus crisis?
So Maria, the one I mentioned earlier was not one that you would typically think of, but it was a public-private partnership between the financial industry and the federal government to get money from the Treasury out to the people that needed it in the quickest, most efficient manner possible. So when we think of public-private partnerships, a lot of times we don't think of the one that is existing between the federal government and the banking industry right now, but that's one that we have been intimately engaged with. I think looking across other areas, I would give us all sort of a mixed grade on the public-private partnerships. I think that the macro side of the FDA working with the pharmaceutical industry and developing the idea for a vaccine, I think has been pretty positive. I think the speed with which this has been done appears to be something that is unprecedented. And my hat's off to folks in the industry that are working in a very collaborative way and saying everyone benefits when we find a vaccine for this. So that's an area working with between the healthcare sector, the private healthcare sector, and the public healthcare sector is one that's very that I see as very positive. The areas where I think that where I think that we have still struggled is maybe a couple of layers down from that, where we have seen smaller companies that have really good ideas that could solve problems in the private sector. Could be a bridge or could be a solution to some of these problems, where they've just had trouble getting the FDA, quite candidly, and sometimes the CDC to change recommendations to try something new. I'll give you a perfect example of that. Hand sanitizer. It's something that obviously every single business is going to have an adequate supply of it, whether you're a healthcare provider or whether you're going to buy food for your animals at Tractor Supply. Whatever it is, whatever business you've got to go into, you're going to have to make sure that you've got hand sanitizer for your employees and your customers. Well, obviously our supply has been inadequate, and we've gone down the road of having, for example, my local brewery in town do hand sanitizer and kind of jump through the hoops there with temporary guidelines there. but then new products that we know could be very, very effective have been very, very slow to get approval. So I think some of this is it's cautionary on the FDA and the CDC guideline, from the CDC's standpoint, and certainly understand that. You don't want to put something out there that that really is not going to do what it says. But I think also being maybe a little bit more creative with that lower tier would increase those public-private partnerships to make things move more quickly.
Yes, no, and I think that's where also I think a lot of our nonprofits and foundations have really amplified the power of the public-private partnership. We're seeing that a lot, but I also think on the vaccine development side, the core of our industry is efficacy and safety. So as these things do progress quickly, I do know that our industry is very sensitive to how the safety of a vaccine and any other therapeutics as well may be. So I know we're watching the data daily and hopeful that we have therapeutics as soon as possible, and certainly vaccine as well. So staying in that realm a little bit, Georgia has some of the world's best global health expertise, not only at CDC, but through a number of NGOs. Especially we have a strong capacity in public health systems and supply chain, as well as clinical trials. How can we ensure that our homegrown Georgia expertise and knowledge, which we as Georgians are very proud of, is shared domestically and globally? How can we harness places like knowledge the Carter Center, CARE, the Task Force for Global Health, and others may have, really,
So,
with the world?
And a couple of things on that, Maria, that I think would be important. First of all, being able to promote that and using leadership positions in the state of Georgia to do that is very important. But we want to see those industries continue to grow and to thrive. And in order to do that, I go back to the very basics of what we talk about. What is the right tax environment to make that happen? What is the right regulatory environment to make that happen? What is the right educational environment to make that happen? I keep going back to those because those are, those things are fundamental to making business decisions within the industry. And where do you make those investments? Where do you, how do you grow those businesses? And then how do you promote those successes? And all of those are a key part of it. I think, to me, when I look at biotech, and the two areas that I think that we need to spend the most time focusing on is, number one, as I said earlier, how do we create the right incentives for more private capital that's patient to flow into the R&D arena? And I think that we can do a lot of that at the federal level, but I think that there's steps that the state of Georgia could do as well. The second component, I really think, is building the culture in Georgia of people that can work in this industry. We've done, if you look across Georgia, we've done some remarkable things from an industry standpoint around advanced manufacturing. We've done it, and when I'm talking about from an educational standpoint. No matter, whatever region you go into right now, there are college and career academies that are developing students and pathways for advanced manufacturing. We're doing that in agriculture as well. And we have certainly been doing it in cybersecurity based off of what we've seen with FinTech in Atlanta, the Cyber Center in Augusta, and the work being done by Columbus State University in the 3rd District here. So again, creating that culture of training people in a pipeline of folks that can be innovative, creative right here in Georgia, I think is a key component to growing the industry and promoting the industry, and Georgia being seen as the #1 spot in the best country to do the business. I think a big part of that is expanding our workforce and looking out into our rural communities at the remarkable talent that's there. And as we begin to push broadband further into our rural communities, I think there's a talent pool there that you can tap into, that perhaps from a research and development standpoint, and the people that are able to do that are in rural Georgia can stay in their rural communities and work remotely, as we have seen so many do now. That's something that's a goal that I think that we should look at as well.
Well, it's like you queued me up for the perfect talking point without knowing. We have, I'm not sure you're aware, but Governor Kemp and a number of senators and other legislators at the state level supported our World Teacher Training Program at our STEM Institute this past year. And
Yep.
it focused on training rural teachers on how to teach life sciences in the classroom. And where we thought we were only going to impact about 5,000 students, we're over 11,000 students across rural Georgia. So we're really starting to build that at the middle school and high school level, that workforce capacity, especially around manufacturing here in Georgia. So Georgia really is primed to be able to provide that pipeline of workforce expertise, which really is in line with some of the companies we've seen look at Georgia to build larger scale facilities, which will allow people and to stay within their communities, whether interested in food and ag, biotech, or and classic medical human health areas of biotech. So we're very proud of that program. We're grateful to our state legislators for supporting that. And we think it's going to be really important that Georgia continue to support that as we work to expand our capacity and continue to respond to COVID. Even if we're able to maintain and show a growing workforce, we can really see some of those jobs come to Georgia in particular. So,
so Maria, to that point, and I'm gonna go back. I'm gonna put my former hat on as a mayor, and talk about that just a little bit more, and about the importance of that to the overall state economy. Historically, what we've seen is a lot of the larger companies that will locate their headquarters within the metro Atlanta area. And we understand that for some capacity, but we think that there's a competitive advantage in rural Georgia if you can train that workforce. And to give you a perfect example, one of the silver linings of this experience is that my adult son moved back in with me for a period of time to work remotely. And great experience. But the thing that he observed is, he said, it is so much cheaper in West Point, Georgia than it is in Atlanta. And so there's a competitive advantage if you can locate facilities and keep people in rural communities, because it is the cost of housing is so much less, transportation costs are so much less, everything is just is less money. So I jokingly say this, but it's true. If you pay my son $100,000 to live in Buckhead in Atlanta, quite candidly, he's in the bottom third, maybe closer to the bottom quartile of the living experience there. He has to have a roommate, probably can never get, a place of his own there. It's a real challenge. If you pay him $100,000 in one of the rural counties that I represent, he not only gets the big house on the hill, but he gets 5 acres with it. So my point is that you can really tap into a talented workforce in rural Georgia that can do a lot of these jobs, and the cost, it's better for them because it's the best opportunity that they've had from a financial standpoint, and it's a competitive edge for the company because they are able to hire people at a lower cost that, quite candidly, are very talented and very motivated. So that's my sales pitch to say, we've got the workforce and we've got the ability in rural Georgia to do this. So with that, I'm sorry I'll get off my soapbox.
No, you're
now.
fine. And we would agree with you on that. The reason we proposed to the state a World Teacher Training Program was for those reasons. So, and that is where we continue to focus a lot of our STEM work right now, though we do continue to support, of course, the Atlanta and Athens region that do hold the core of our industry. So with that, I'm going to pivot. We have another question. And how can CDC, and you may be able to answer this, how can CDC expand their recommendations of the FDA compliant hand sanitizers with benzalkonium chloride to meet the extreme shortage of hand sanitizers?
Well, that, again, is a perfect example of, sort of the supply chain issue that we were talking about earlier. At what point, or how can we encourage the CDC and the FDA to look at some of these other innovative ideas out there? There've been a lot of conversations. I've had conversations with the administration about this. I've had some conversations directly with FDA about it. And there's a real balancing act that they've got to do right now. As I said earlier, you don't want to. They've got to feel comfortable that the products are in fact going to do what they say they're going to do. And they're trying to do that in the context of just a tremendous volume of other activity that they've got going on right now. So we stand ready to do what we need to help them make that transition and to be a little bit more innovative on that lower tier of ideas, and would encourage them to do it. Again, and I would say this, if they can't do it, and there's a specific reason, I think it's important to tell the manufacturers or the entrepreneurs why that can't happen, and what the hurdles are and what steps are needed to get that approval. I think what I've heard from a lot of smaller businesses is that that they have just been told no, or it's in process, but they haven't been given the reasons why and the steps to go from point A to point B. And I think that if there's one thing that we could encourage them to do in their limited amount of time, given the workload that they've got, is to streamline that process to say, here's a product, here's what you've got to do to make it available to the public in a very short time frame.
Great, thank you. What is the federal government, HHS and BARDA's distribution process of the billions of dollars in support of R&D for vaccines, therapeutics, and diagnostics? Decisions making, timelines.
Maria, I'm sorry, could you ask that one again? I kind of lost you there. I think
of course.
A headphone going out, so I'm gonna swap over and put another one in.
You're good. I'll give you a second to do that. Look, are you good?
Yep, I'm good now.
Okay, perfect. What is the federal government, HHS and BARDA specifically, distribution process of the billions of dollars in support of R&D for vaccines, therapeutics, and diagnostics? Timeline, decision-making process, that type of thing.
So the one thing that I have seen so far is that I would call this a reasonably opaque process, in that the entire response seems to be get money out the door sooner rather than later, and let the private sector deal with it. That's been sort of the approach. That's what we have wanted to see happen. I am not that familiar with exactly the how HHS and BARDA are doing this. Other than we hear a lot of things happening that make it seem as though the money is flowing out pretty quickly and people have access to it. I haven't seen any specific data or reports on that yet, but I would be willing to bet that it's probably a little bit like the last issue that we talked about. At a macro level, it probably looks and feels pretty good. At a much smaller practical level, there are probably a lot of hurdles that a smaller firm may be really having difficulty. So I think that there's probably a lot of resources going to larger companies that are how can I say, that are further down the road on certain aspects in terms of testing. Not saying that they're better than a smaller company. I just think that they probably have a little bit more horsepower to tell that story. And I would imagine once you look at the data that you'll probably see that some of the larger companies have got better access to the funding. But again, that just may be a function of, where do we get the resources out quickly, because the president and Azar and Mnuchin and everybody else has been involved with it has said, get the money out the door, and speed is more important than anything else. And so that's why I think that there may be, when you do stuff, I want everybody to keep in mind, we have, at this point, Congress has appropriated about $3 trillion worth of spending towards this. And I want you to think about, in a $3 trillion spend, this has all happened since March Friday the 13th. Okay. When you push that much money out that quickly, number one, it's hard to do. It's like winning the lottery to some degree and say, how do I spend $250 million in a month? It's actually pretty hard to do. And so I think I think it's good that we've done that, but we're very aware of the fact that there are going to be some conversations that, because we didn't go through regular order, we haven't had regular committee meetings, we haven't had the normal approval process, that there are just going to be some folks that get left out of this conversation, and not sure how we go back and fix that retroactively. I'm not sure that we can, but I think going forward, it's, we probably should have a conversation about if we were to do this again, how do we create openness across different sizes of business?
Yes, and just to kind of expand on that your comments and that question. So how would you compel HHS and BARDA to not be so highly focused on collaborations with major corporations? While recognizing, I mean, at some point, smaller innovative companies will be forced to consider strategic collaborations and investments from non-US sources like China to move forward. That's a question from the audience.
From that specific, I don't have a specific answer on that one, Maria. Happy to, that's an area that, looking at the operations of that, I'm not as engaged in that piece of it, but happy to have another call so that some members can educate me on where we need to be on that.
And I think that's where our industry, our industry in Georgia and most southeastern states, they're small companies. So I think that's very of great interest to if your statewide constituency, I should say. So, how that will pivot eventually. We're having questions come in, and I'm going to do maybe 8 more minutes of questions, and then we'll close it out. How are you keeping your constituents informed on COVID activity and testing locations? Or have you seen any best practices for communities, organizations with their employees? I think that's something that, that narrative and that communication is still, it's slowly coming out, but it's definitely not perfected yet.
No, and so what we do from our congressional office is obviously our social media and our website are the ways that we can actually get out right now. So we push out a lot of information through our social media and through our website. I think what we have found, we realized that we touch just a limited amount of the district with those platforms. I'm glad that we do touch those, but we have found, and we think that it's important to be on the phone with our business community, talking to them about how to get that message out. And so we do a lot of industry calls specific to the district, whether it's in a group setting like this, a video conference, or I would hate to even know the number of individual calls that I've had with a business, talking to them about where to get the resources, how to get that message out. Because for every business owner that I talk to, they have the ability to touch literally thousands more people than I can individually through a congressional website. So that's something that that we have found to be more effective, is to be engaged with our healthcare systems and our business community, because that we found those to be the quickest avenue to the public to get information to them.
Well, that's great. Question from the audience, it's pivoting a little bit, but we've been hearing this too. How is Congress addressing the class action suits related to COVID-19, which are on the horizon from lack of PPE, which we all know that's coming? Any comments on that one?
It's I try not to be too terse in my comments around that, but the fact that you've got trial lawyers circling above the field, looking for the weakest victims, is just absolutely something that I have no stomach for. However, as much as I would like, and I know many would like to see some sort of tort reform or some sort of immunity in this process from litigation, I think the chances of the speaker allowing that piece of legislation to hit the floor are slim and none. The only way that gets done is that would have to be put into a bargaining process, where in order to get the tort reform done, there would have to be some really crazy policy on the far left that you're going to have to balance that with. Don't know what that would be. Don't even know that that's going to be in the conversation. As many things as we have seen try to move through the House, the one that seems to be the most consistent non-starter is any sort of tort reform. And that's what, and I've told a group earlier, I think it's important, you know, the governor in the state of Georgia, through his emergency declaration, has issued some immunity to frontline healthcare workers and health systems. And I think the argument that we've made with them is that, and I've made this at the federal level as well, when we've asked certain businesses to close, we've had to provide them the relief that they need so that we didn't close them forever. Meaning that if we told a small restaurant you can no longer seat patients and operate, we made available to them the personal protection loan. On the flip side of that coin, we've had certain businesses that we've told you've had to stay open. You are essential and you must stay open. And I think providing immunity to those businesses, because we have told them that they have to stay open, I think is providing them the same, in some regards, help, just like we've provided those businesses that we've told to stay closed. And because in some cases businesses would not reopen, because of fear of liability, and if the state or the federal government had not told them that they had not deemed them essential. So I would like to see the governor expand that in the state of Georgia. Mm-hmm. I think that's a reasonable thing to do. I think the state legislature should take this up as well. Again, at the federal level, as badly as I would want to see tort reform done, I think it would be unrealistic to tell you that it will get done without some sort of major balancing ask on the other side.
Sure. So thank you for that. I think we have 2 questions left. So, and I will say we do, most of our industry is essential employees, so we do appreciate that. And we appreciate the governor letting us provide some guidance around what our industry why our industry is considered an essential, and we continue to work hard as an industry to try and help with the response. So second to last question. Gilead has over $20 billion in annual sales, over $10 billion in annual operating income. Why must NIH fund their, I apologize, I'm bad with saying this, remdesivir trial at the expense of funding small innovative companies?
Specifically, I would imagine that is statutory, and they've gone through the process and applied for whatever grants and funding that they need, and they met that. And if we're going to go down that road, then similar to the earlier conversation about how do we get access for smaller companies, I think it's becoming more and more apparent that that's going to be part of the conversation going forward. So you know, again, if they've applied for it and they got it through the process, then that's what it is. But you know, the thing that we don't want is we don't want smaller companies shut out of that. And again, we've talked about this, whether it's at the, you know, sometimes these bigger macro projects seem to get all of the attention, but there's this. Yeah. I'll say it again. We have to figure out how to make innovation and research and development dollars work, and create different value on the front end for these innovative companies, so that we can keep them going. And certainly understand the fragility of a lot of the bio industry here, where you simply don't have the staying power. True small businesses starting up that you know, that are very susceptible to significant changes in the market. So we understand that and willing to continue that conversation.
Great, thank you for that. So last question. We've seen very surprising shortages of key drugs and PPE for hospitals treating patients, and we continue to see some shortages of PPE for companies to be able to access as they bring their employees back. What should we do in the future to avoid being in this place when the next crisis occurs?
Well, it's two things on that point. Number one, you know, obviously being able to ramp up. We've never had a system of anything where we've needed or contemplated supplying the entire country at one time with everything from testing. Our testing systems are not set up for that. Our personal protective equipment is not set up for that. So again, I think this is something that we're learning on. You're going to see a lot of discussion about production here in the U.S. and making it available in the U.S. At what point, though? I mean, we've got to be strategic in what we in what and how much we bring back to build manufacturing capacity, so that we're self-sufficient. But if all of a sudden we build a national inventory over the next 2 to 3 years of the N95 mask, let's use that one as an example. If we build all of that out, at what point do you look at it and go, okay, we've got enough that we can give every man, woman, and child, however much they need for as long as they need it? Well, if you do that, then once that capacity is met, then what do you do with that manufacturing capacity that you've invested tens of millions or maybe even hundreds of millions of dollars in? What are you going to be able to do with that? So I think we've got to be strategic, where we don't all of a sudden rush everything back and disrupt supply chains. I think we can do this. I think we can become, have the ability to become self-sufficient here, but we have to be mindful. We don't want to strand literally hundreds of millions of dollars in capital investment for something that we're going to overbuild for the future. And I worry that may be where we're headed with some of this. So I think we've got to find the balance on that. I'll go back to it. I say this all the time. You have to find the right balance between taxes, regulation, and education, and have the right investment environment, so that you can make as many things here in the U.S., because it's the best place to do business. I think if we try to do it from the standpoint of we're going to do it solely from the standpoint of being self-sufficient, then I think we'll have a cumbersome, overbuilt supply chain system. I think if we do it from the standpoint that this is the place where it makes the most sense to make those investments, through doing things, looking at IP protections, okay? If you're innovating something here, we want those IP protections to be as strong as possible. Again, the right tax environment, to where this is where capital flows and can wait patiently, and we can get good returns on that. Training the workforces we've talked about, being able to build the infrastructure to your facilities to be able to produce the products. All of those kinds of things make sense to do, because it's not just for the PPE supply chain or the pharmaceutical supply chain. That's good for all American business. So I think that's the philosophy that we've got to take, is a very pro-growth policy that we lead the world with.
Right. No, thank you for those remarks. I think that's a great place to close. So I'd like to thank, of course, the Congressman for joining us today for an entire hour. I know you're very busy, but to my members, on May 11th at 11 a.m., we'll be having another webinar. This is going to be featuring our Bio-Business Solutions program. I know many of us need to save money right now, so please be sure to tune in and take advantage of that. And on the 14th, we'll be welcoming at 1 p.m. Senator Butch Miller and Senator Dean Burke for another one of these conversations. As we continue to work on our back to work recommendations for the life science industry, please don't hesitate to reach out if you have questions. We will be working with counterparts around the country, like I said, as well as legal advisement for a webinar around that topic for our industry. Georgia Bio's convenience will remain virtual for the foreseeable future, as large gatherings cannot happen. So if you have suggestions, please let us know. Do know that we are working on a CRO and CMO symposium. We have a committee that was just stood up and will be meeting for the first time on Friday. So if you have any interest in that space, let us know. Additionally, we're working with partners in big pharma and biotech to pull together a patient advocacy summit. Though, of course, patients suffering with COVID are definitely top of mind at the moment for all of us, on top of the news feeds. There are many patient populations in all sorts of areas that are really being hit hard by this, because they cannot hold their fundraising gatherings and other things like that. We need to remember the R&D and the research and the care that's provided to those patients as well. So we think it's important to go ahead with our planned patient advocacy summit. And if you have any interest in getting involved, do let us know. That group will probably start meeting in a few weeks. Thank you again to Senator Ferguson for your support of the industry for a very long time. You've been a great partner, and it's good to hear your support for bringing R&D back to the state side, and support for that growth in Georgia as well, and your passion for the workforce building. We certainly wish you and the people of 3rd District well, and to everyone else on the call, be safe and be well. Any closing remarks?
Listen, thanks again for the opportunity. A couple of these topics, again, I would invite feedback, things that you heard on the call that we need to be better informed on, or things that we may need to push harder on. Certainly, Maria, if you can get those comments back, we'd happy to take those and learn from them. And I wish everyone on this call well. Be safe, and let's get America back to work.
Yes, sir. And if anyone has any questions, just shoot them over to us, and Joseph will make sure we get those questions into the congressman and his staff, as well as any other questions that may not have come up today. We'll definitely work to help you find those answers. So thank you again, and have a lovely afternoon.
Thank you. Bye-bye.
Thank you, Congressman.